This is Mary Lou Novak, and we're here for Resource, the number 4, Care. And Resource for Care brings free education to seniors and their adult children regarding health and wellness. And we do that through interviewing professionals in that realm, in the health and wellness fields, and make that available free. And the best way to get those recordings of podcasts or YouTube recordings is just to go to the website, resource, the number 4, care.com. And today we have McKenzie Sandroni. She is an audiology extern with Thrive Hearing and Tinnitus. I want to say tinnitus because I'm from the Northeast, but tinnitus. And we met at one of the networking events, actually.
Probably through NABO.
And when I heard about the work that McKenzie's going to be doing to bring hearing to those that may be underserved, I said, I have to get McKenzie on this show and share what she's doing. It's amazing. So tell me a little bit about yourself, and then why this? Like, why and what is it that I'm alluding to?
Absolutely. So I'm completing my AUD with the University of Memphis.
Okay.
Alongside that, I've gotten my public health certificate, and that's important for this conversation because a lot of what we're doing focuses on public health. So I'll talk a little bit about what that is.
And what's an AUD?
The Doctorate of Audiology.
Okay, because most people, average person, might not know that.
Yes.
So that's impressive. Doctorate of Audiology. Wow.
So for those that don't know what audiology is, it's anything in hearing healthcare.
Okay.
So when you think hearing loss, tinnitus, vertigo, hearing aids, cochlear implants, the list goes on.
Wow.
That's an audiologist.
Okay. And for those that don't know tinnitus, I mean, if you have it, you know what it is.
Right.
But give us a little bit about that, because not everybody knows what that is.
Tinnitus, or sometimes called tinnitus, is a sound that you hear that others do not. So for most people, this is ringing, buzzing, chirping, or roaring.
Interesting.
So any sound that's happening, a lot of times hearing loss can come with it, but sometimes it doesn't.
Okay. And I would think that's pretty nerve-wracking to be dealing with that, I would imagine.
Yes, and it can cause some mental health concerns in patients, and so we like to focus on finding the root of it, why it's there, and what we need to do about it. We help people with it every day, because most people are told there's nothing you can do about tinnitus, and it's not true.
Okay. And you know, my husband suffers with it. So,
I didn't know that.
Yes. So I have been slowly coaxing him
to
come to your office. So you will be seeing him soon.
Taking that first step is hard.
It is.
He'll get there.
Well, because people, like you mentioned, he's been told there is no cure for this. There's nothing you can do.
Yeah.
So he's just living with it.
Right. Right. We see that a lot, and with hearing loss.
Okay. Interesting. So we had the owner, Casie, on not too long ago talking about how hearing affects mental health, and that was great. So go to the website or the Aging in Memphis podcast to listen to that great information. But the thing that really stood out to me was the program that you're putting together, and that you're going to be, now is it officially launched, or is it about to be launched, or?
As of January 1st, 2025, it is official.
Awesome. So how are you bringing hearing or fixing the hearing issues of the underserved? Tell us about it.
Yes, so we are partnered with Church Health. And for those who aren't familiar with Church Health, it's a nonprofit clinic in Memphis, Tennessee, located in the Crosstown Concourse. And Ken Hall, who works there, said it best. They provide health care to people who have to choose between groceries and rent. And with the belief that health care is a right, not a privilege. And so they're trying to close the gap there.
Yes.
So many amazing things come out of that for our community.
Yes.
So one thing they did not have until now is audiology services. They have most every other healthcare you
They
can
even have
imagine.
dental, don't they?
They
Dental?
do.
Yeah.
So it's really amazing.
Yes, it is.
Our listeners and viewers should look at their
Yes.
website for sure.
I mean, just a little bit about Church Health, because I got involved with them a couple years after moving here. We're very lucky in Memphis to have this resource. I mean, it's given me chills talking about it because doctors volunteer their time to provide care. So we're not talking about second-rate care. We're talking about top-notch care in the Memphis area. And it's so unique. I mean, they've tried to duplicate this in other cities, and it's difficult to make happen.
It is.
But they make it happen here, and they've been doing it for years. So definitely, as McKenzie mentioned, go to their website, look into it. If you don't need the care, look into how you can support what's going on. But enough about Church Health for the moment. So what are you doing? What are you bringing having to do with audiology? What are you doing to make it affordable for the masses?
Yes. So like you said, two things you said stood out to me. One, that doctors are volunteering their time. So
Yes.
that's what we're doing. Any service that we provide, we are providing free of cost to these patients.
That's amazing to me.
Two, you mentioned this is top-notch care. And that's part of our beliefs too. Patients from Church Health are going to get the same care all of our other patients get. Same level, same quality, same exams, same equipment. Because that's how it should be.
Yeah.
And so patients that go to Church Health that have any kind of hearing or tinnitus concerns need to see an audiologist. Church Health refers them to our office.
Okay.
So they will actually come to our East Memphis location. They'll be treated just like any other patient, of course.
Yes.
And we'll get the same care. So we will start with whatever their need is.
Right.
More than likely it'll be a hearing exam or a tinnitus exam. And if they need hearing devices, we are fitting them free of cost through our hearing aid donation bank.
Okay. That's great. So there's another element to it, right? So if part of the solution for their hearing loss, for example, is hearing aids, that's another barrier, right? Because you're not a manufacturer of hearing aids, I don't
Right.
think, unless I misunderstood.
No, that's
So
correct.
you're just but you're diagnosing the issue
Right.
and recommending what needs to get done. But I mean, what do hearing aids cost? I don't have an idea. I never had to purchase them, but I hear they're expensive.
Yeah, they definitely can be. It hits us harder because insurance does not cover as well as we would like. So for the patient, the number is much more prominent than other medical equipment, right? So
When you say the number, you mean the cost?
the cost.
Yeah.
So
yeah.
looking at, on average, a range of $3,000 to $6,000
Wow. To solve your hearing loss
to
problem
solve your
with
hearing
the
loss
device.
problem. There are some options below that.
Yes.
But you begin to sacrifice processing and quality of sound and clarity.
Right. And I would imagine, just like any technology, certain ones are less expensive to operate than others.
Correct.
So they cost more on the front end.
Correct.
But then, if you need to buy, I don't know, $20 battery, I'm making this up, batteries every, couple
Right.
weeks, that adds up as well.
It does.
So
Yeah.
the probably the higher end ones are easier to maintain and to keep running.
Yes, they can be. They work better.
Yeah.
They have better outcomes that we do in the office that these patients will get as well. And a lot are rechargeable now, so that's really nice.
Yes. So the other part of what I heard you talk about is that you're came up with a solution to that. And what is that all about? How does that work? Donating or...
Yeah,
Yeah.
so our hearing aid bank and where we're getting those, those are donations from,
Okay.
a lot of them so far have been our patients
Okay.
or family members of our patients who have passed. And our goal is that getting the word out to the Memphis and surrounding communities
Yes.
is that we can increase that and
Okay.
get more, because the last thing we want is to run out of hearing aids
Sure.
and these patients have to wait.
Yeah.
So we are looking at a couple manufacturers. We're applying for some donations through them because
Okay.
they have some foundations.
Yeah.
But our community can really support us by giving us devices that they no longer have use for.
Right. So what we're saying is, or Mackenzie's saying is that I think you have relationships with all different manufacturers
Right.
that they're willing to partner with you and refurbish.
Right.
I mean, donated hearing aids. So we're putting a call out there to the public that if you have a loved one that either no longer needs them or has moved on to a different issue or different device, reach out, and McKenzie's information will be available through the podcast, or just go to Resource for Care and there's a place to contact me, and I'll put you in touch with McKenzie and let's get them donated.
Yeah, absolutely.
So how long has this program? It started in January.
Started officially
Okay.
in January.
So has it started? Have you started seeing patients already, or how's that going?
We have gotten our referrals, and I think we have a few patients scheduled starting at the end of this month,
Okay,
but have not fit anyone just yet.
Okay.
Still brand new.
so brand new.
But we do have a good bit of hearing devices to work with starting
Okay.
out because of our generous patients.
So if you had something, if you were able to share, tidbits of any information with clients, what would that be? I mean, what is the common denominator? What are some of the things that you wish you can wave a wand and have people know about hearing?
About hearing, well, definitely some of the points that come to public health. So a lot of times people think hearing is it's just me.
Right.
And sometimes I have to ask people to repeat, I can live with it, it's fine. But what we actually know is it has a lot of other implications. So one of the biggest ones being if you have a hearing loss that has not been treated or
Right.
addressed by an audiologist, your risk of cognitive decline can increase. And so we're seeing that with patients who cannot afford treatment.
Right.
They're now at a bigger risk for that.
Okay.
And that has a lot of other implications.
Yeah, I can just, my mind's flying,
Yes.
thinking about all the things that, if it's going to accelerate decline,
Right.
mentally or physically.
So then you start
Yeah.
to think about the mental and emotional toll that plays on the person.
Yes.
Their family members.
Sure.
Could get them out of work sooner. Could get an increased rise in health costs for
Right.
various reasons. So
Sure.
it begins to be this ripple effect.
Yeah.
And hearing loss, correcting for hearing loss is the leading thing we can do to address that.
Okay.
So it's really important for all patients, including these patients, that we get them fit as soon as we can.
Right.
Looking at job opportunities, job retention, we want all of
Sure.
our citizens in our city to be able to do the job they like for as long as they can.
Yeah.
If you have hearing loss,
Right.
you can't get corrected and it becomes a problem at work,
Yes.
sometimes that can affect your promotional opportunities.
Well, I think, we all come to the work environment with our own, personalities and everything. And part of excelling in your job is working with others if
Yes.
you're in a company or even if you're dealing with the public. And I'm just thinking of all the things that could happen with those relationships.
Yes.
How it might be difficult to fit in or to assimilate. Especially if it's a hidden issue. It's not something that people, are, if you come in and you're in a cast, people know you have a broken leg, right?
Right.
But if you have a sort of an invisible
Exactly.
challenge,
Exactly.
people are, unless you share, people aren't going to know.
I'm so glad you brought that up because it can definitely impact relationships at work. Some specific examples can be you don't hear someone talk to you and then they think you're being rude
Exactly.
because you didn't
yeah.
respond. Or people in your life, even relationships at home, begin to be frustrated with you because you have to ask for repetition. That causes tension in relationships. And also a very common side effect of hearing loss is social withdrawal because it's too hard, too stressful, or you feel like you can't participate in the conversation anyway, so why bother?
Right.
So then that affects mental and emotional health, but it
Sure.
also affects, the seat at the table when the big decisions at work are being made.
Right.
And things like that because you're not going.
Exactly.
So it has a lot of implications there.
Yeah. Yeah, I mean, if you're not able to absorb the information, how can you then, participate fully when it comes time to contribute?
Right.
Absolutely. So, how can we help you do what you're doing? I mean, what can we all do to support what you're doing for these folks?
Yeah, there's 3 great ways.
Okay.
So the first one being supporting Church Health directly, and you mentioned that. So churchhealth.org/give/donate will take you to a monetary donation.
Okay.
But just the Give site itself has some other options, and that's great because they support our patients and we're volunteering to help there.
Yes.
So they need support always. A second thing is helping us spread the word about this program so that people in your life or people listening to this podcast know there is a place to go if I can't afford this care, and it's Church Health, and they'll get me where I need to go. Because we want to be able to serve as many people as possible to help them be active and engaged in our community and connections. Yeah. And the third way is twofold. One, if you have devices at home that are yours or loved ones that are not being used, even if you think they're too old, please bring them. We will do everything we can to get them working, and something is better than nothing. Okay. But also spreading the word there, because what I have found is many of my patients that find out we have a donation bank are shocked, and they say, well, I've had these hearing aids in the drawer, they were my husband's for years, I didn't know what to do with them. Right. So people don't know that there's a place to do this, and there aren't many. And so we're going to have drop boxes hopefully around the city coming up to make that simple for people.
That'll be great. This particular podcast is brought to you by Eagle Hollow Enterprises. Eagle Hollow Enterprises is your resource for insurance. So when you are not sure who to reach out to, you want to reach out to Genell Holloway of Eagle Hollow Enterprises. And all of these recordings, both for the podcast and on YouTube, are all available at the website resource4care.com.